Ever wondered how antiarrhythmic medications work? Today, we're going to delve into the fascinating world of pharmacology to demystify Class 3 and Class 4 antiarrhythmic agents, along with a unique player in the field, adenosine. We'll explore the mechanisms through which these drugs act, their indications, the considerations that nurses need to keep in mind, and the potential adverse effects they might have. So if you're ready to unravel the mysteries of these medications, let's dive right in. Prepare to unravel the mechanisms, indications, nursing considerations, and adverse effects of these medications. First up, we have Class 3 potassium channel blockers, crucial in managing arrhythmias. This class includes medications such as Amiodarone, Dronedarone, Dofetilide, Ibutilide, and Bretylium. Their primary function, they prolong repolarization by blocking potassium channels in cardiac cells. Take Amiodarone, for instance. It's a bit of a multitasker. Not only does it block potassium channels, but it also antagonizes alpha and beta receptors. It's a potent player reserved for severe, life-threatening ventricular arrhythmias that are unresponsive to other treatments. But with great power comes great responsibility. Nurses need to be vigilant when administering Amiodarone. It can pose risks, especially in pregnant patients and the elderly with compromised organ function. And let's not forget about potential adverse effects, which range from pulmonary toxicity to neurological impairments and GI disturbances. A lot to keep in mind, right? But don't worry, we're just getting started. Up next, Class 4 calcium channel blockers. Moving on to Class 4 calcium channel blockers, we have verapamil and diltiazem. These two power players in the realm of antiarrhythmic medications are all about slowing things down. They work by increasing the refractory period of the AV node, reducing heart rate and controlling certain arrhythmias. Let's talk more about diltiazem. This drug doesn't limit its effects to the heart. It also relaxes smooth muscle and decreases peripheral resistance, making it a valuable ally in fighting conditions like angina and hypertension. But as with any medication, there are considerations. Nurses need to keep a vigilant eye on patients taking diltiazem. It can exacerbate symptoms in patients with heart failure and may lead to adverse effects. These can range from bradycardia, a slow heart rate, to syncope, fainting, due to a drop in blood pressure, and even hepatic injury, damage to the liver. So remember, while diltiazem is a potent tool, it requires careful monitoring. Diltiazem can exacerbate heart failure symptoms and lead to various adverse effects. Lastly, let's talk about adenosine, a unique medication used for paroxysmal supraventricular tachycardia. You might be wondering, what makes adenosine so special? Well, it has a very specific action. Administered as a rapid intravenous bolus, it briefly slows down the electrical conduction through the atrioventricular, or AV node. This allows the heart's rhythm to reset and return to normal sinus rhythm. However, as with all medications, it's crucial to be aware of potential adverse effects. Adenosine can cause a variety of reactions, some of which can be quite alarming to the patient and those around them. Immediately following administration, patients may experience a sense of impending doom, shortness of breath or chest discomfort. This typically resolves within a minute but can be quite distressing. More severe reactions include prolonged asystole, arrhythmias, and even seizures. So while adenosine can be a lifesaver, it's crucial to administer it with caution and closely monitor the patient's response. Adenosine isn't without its risks, including prolonged asystole, arrhythmias, facial flushing, and even seizures. And there you have it, folks. We've journeyed through the intricacies of Class 3 and IV antiarrhythmics and the unique adenosine. We've seen how they work, their uses, and the crucial role nurses play in patient care. It's clear that while these medications are vital in managing arrhythmias, they must be administered with caution due to potential adverse effects. But equipped with knowledge, we can ensure safer patient care. Remember, always stay informed and stay safe. Until next time, happy studying